Welcome to Revenue Protection Strategies for Physician Practices. This program is part of a series of educational practice management briefings sponsored by McKesson. Aimed at physicians and practice managers, this series offers advice on how to position your practice for sustained growth in a changing healthcare market. In this program, we will focus on healthcare enforcement programs and its impact on physicians.
The anti-fraud initiatives are increasing significantly in an effort to return money to the Medicare Trust Fund. These entities are being tasked with auditing and enforcement of payer policies such that they can return that money to the Medicare Trust Fund. They've been very successful. Estimates indicate that these entities are returning $1 to the Medicare Trust Fund for every 20 cents expended. Well, some of the more well-known enforcement programs would stem from the Office of Inspector General Work Plan, the Recovery Audit Contractors, which are commonly referred to as RACs, the Comprehensive Error Rate Testing Program, referred to as CERTs, and the Payment Error Rate Measure Program, which is a Medicaid integrity program. The impact on physician practices is that you'll see a significant increase in auditing. You'll see this in the form of audit requests, documentation requests, and a significant amount of overpayments being requested by these entities. Well, just last week, these recovery audit contractors began publishing the focus areas that they'll be looking at initially. Two of these recovery audit contractors published on their website those areas for focus, and they're actually split by hospital and physician focus areas. So if you look at each enforcement area, it will indicate whether it applies only to hospitals or also to hospitals and physicians. And there are quite a few there that are specific to physician practices. McKesson is uniquely positioned to assist our clients through education, making our clients aware of these initiatives such that they can engage in self-policing of their own activities. We also have our own programs in place where we monitor the Office of Inspector General Work Plan enforcement items, the Recovery Audit Contractor focus areas, as well as CERT and PERM focus areas. And we conduct proactive measures as well as reactive measures to scour our claims repositories to self-police prior to even before receiving notice from these entities. The key points that would help physicians manage these emerging enforcement trends would be, number one, be aware of those enforcement trends. Monitor the Office of Inspector General's work plan each year. Look for items in that plan that may apply to your specialty or your practice. Also, scour the recovery audit contractor websites. Be aware when they publish new enforcement initiatives. Also, monitor CERT programs, PERM programs, and any letters you might receive from those programs. Keep a log of those inquiries that you receive. Ensure that you're responding completely and timely to those letters, and then also implement proactive measures within your practice to self-police on those areas. The objective would be that you've identified those issues that you became aware of as published by these entities, that you self-policed, and by the time an auditor actually came to your door, you had already identified any issues and already completed your corrective action.
This has been Revenue Protection Strategies from McKesson. Our consultants are available to answer your questions by phone or email. For more information on healthcare topics relevant to physician practices, visit our website.